Good morning, everyone. This is Sherri, also known as Every Step Nurse. It is 5:40 in the morning. I'm already dressed. I have my cup of coffee, and I am going to start my day. I'm going into work today for a partial shift. Usually I work 12 hours, but I am doing an 8-hour shift today. I am a Med Surg float nurse, so if you guys have any questions, please ask me. I am here to answer them throughout the day. I hope you guys enjoy my stories with Nurse.org. Hi everyone. So Med Surg nursing is a very diverse specialty. You can care for patients in a pre-op setting. You can also care for patients in a post-op setting. You can also care for patients under observation and just managing their illnesses on a day-to-day basis. As a Med Surg float nurse, I float to many departments. In the emergency room, you see a lot of trauma patients. You see a lot of psych patients as well. You have to stay on your toes, and it is fast-paced. As a Med Surg float nurse, I also float to an oncology unit. Working on oncology definitely hits home for me because I have family members who suffered from cancer. I also have family members who passed away from cancer. For me to be a nurse to assist in the care for patients who are fighting is absolutely rewarding. The nurses who are oncology nurses who are certified, I tilt my nurse's hat off to them because I can tell you when I do float to that floor, I have left work many times crying. And I am just grateful that I'm able to assist with the care for the patients when I am on that floor. So it is rewarding. As a Med Surg float nurse, I also float to the telemetry department. And I have to be honest, I've only floated there a few times. And if I have to be honest again, Telem is not my fave. I had a difficult time in nursing school. And, those are just special nurses. They are no joke. And you know what? You guys will always have a special place in my heart. But if I had to pick a specialty myself, it would not be Telem. As a Med Surg float nurse, I also float to the neuro unit. And on this unit, you may have some patients who have TBI, strokes, epilepsy, just to name a few. And on this unit, you have to think this is neuro. So a lot of the patients lose their function of speech. They lose their function of swallowing. They lose their function of mobility. They also lose their function of eliminating urine. So you have to constantly perform assessments on these patients. And also you may have to bladder scan them every few hours and straight cath them every few hours because a lot of these patients retain urine. As a nurse, I want you to remember this. Any student, any nurse, never, ever, ever, ever be afraid to ask a question. I don't care how many years of experience you may have, ask questions. Trust and believe if I do not know something, I am asking. You are always learning as a nurse. It never stops, it never ends.
It gave a lot of things, but it never gave give up. It gave difficult, it gave hard, it gave those things, but it never gave throw in the towel. Because who and what is that? Keep pushing, love you.
Hi everyone. So I want to talk about some misconceptions when it comes to Med Surg nursing. In nursing school, we were taught that as soon as you graduate nursing school, you need to do Med Surg. I absolutely do not agree that you have to do Med Surg right out of nursing school. I think new nurses should try any specialty that they choose. you obviously don't have to go to Med Surg, but some nurses actually love Med Surg, like myself. I think another misconception about Med Surg is that a lot of the nurses do not enjoy being Med Surg nurses. I can honestly say that I've run into obviously a lot of Med Surg nurses, and they absolutely enjoy it because they have a generalized population caring for patients. So they see everything, they do everything, and they absolutely love caring for this population of patients. So I worked in healthcare for over 20 years, and I worked in different entities. When I was a CNA, I worked at an assisted living for 5 years until I became a licensed practical nurse. As soon as I became an LPN, I wanted to spread my wings as a new nurse. So I worked at a pediatric doctor's office, and I worked in peds for 1 year. I knew in that moment that this wasn't for me, and I need to go back to a geriatric population player working in that population because the workload is heavy. The wonderful thing that I like about skilled nursing is that the people that you work with become family, and so does the patients. So skilled nursing facilities does not get enough light shed on it, but I have to be honest, I've had great experiences working with skilled nursing facilities. The last nursing facility that I worked for, a lot of the employees were there for 20, 30, and 40 years, and it was a family-owned business, and you can tell that the staff members loved what they do. They loved caring for the patients. They loved the family orientation that the skilled nursing facility provided. And working in a skilled nursing facility, it's easy to climb up the ladder there. And I was fortunate enough to be the staff educator at the skilled nursing facility where I made policies for the facility. I did the orientation for the new employees, which is why I love encouraging nursing staff, nursing students so much. I did the orientations. I organized the clinicals for the surrounding universities. So I absolutely love, I love being a staff educator. So that's the beauty about being a nurse. You can switch your specialty at any time. You can try different things to see what fits you.
I want to sit down at a good restaurant, okay? I want there to be chips and salsa on the table. I want a fat margarita, okay? And I want my friend to look me in the eye and tell me something so scandalous that my jaw is on the floor, okay? I want to be shook to my core. I want fajitas to come out sizzling. I want to be making fajitas as somebody unloads something so intense that we don't know what to do, all right? But then we make a roadmap, and then we have some sort of resolution by the end of the meal, and then I go home, and I sit on my couch, and I watch my shows. That is what I want for my day.
So because I found a new love for educating and teaching future nursing students is the reason why I created Every Step Nurse on Instagram. So I created Every Step Nurse to inspire and encourage future nursing students. I was a young mom. I struggled financially. I struggled in nursing school. I dealt with tragedy in my life, and I still had the drive throughout all of that to finish my passion in becoming a nurse. I'm still driving because I want to become a nurse practitioner. So I hope that my Instagram page can inspire and encourage future nurses. And also, I hope you guys can get a good laugh from my reels on Every Step Nurse. I hope you guys enjoyed my takeover with Nurse.org. I definitely enjoyed my time with you guys. Bye.